Hi everyone, today is Thursday, July 30th, and this is Dr. Wendy Fortna with your COVID-19 update for Hanna and Special Areas. I'm going to start off by letting you know that we found out our audience is actually much broader than just the Hanna area. So for anyone who's visiting our video from outside of Hanna, I am one of the 4 family doctors that practices out of the Hanna Medical Clinic, and I'm also the facility medical director for the Hanna Health Center. So as of today, we are still having increasing numbers of COVID-19 cases, both within the town of Hanna and in the rural special areas number 2. As a result, I would like to remind everybody that we need to maintain our precautions and not get too terribly relaxed with our summer plans. I have a long list of topics today, so bear with me. The first thing I want to update you on is please remember that when you are coming to the medical clinic for an appointment, sometimes we are a little bit behind, but for the most part, we're getting better at being on time. If you know you have to drive from a distance, please be in the parking lot ready at your appointment time, not on your way to your medical appointment at your appointment time. Also, sorry about that one. Please also remember to call us from your vehicle because we don't know that you're here until you let us know that. If you do not have a phone that you can carry with you in your vehicle, let us know and they'll get a description of your vehicle and the nurse will come out to the parking lot and look for you at your appointment time. Right now, lab and x-ray are both open. You require an appointment for any lab test to be done. This is going to be whether you get your requisitions from here in Hanna or if you have a requisition from a specialist. You need to contact the 1-800 number in order to book an appointment for lab tests up at the Hanna Health Center. If you have a diagnostic imaging, which would be an x-ray requisition, you can walk in for that service during normal working hours. If you see your physician and they want you to get lab work done that day very urgently, your physician is responsible for contacting the hospital and ensuring that they have room to accommodate you at this time, which they most definitely will make room even if you have to go through the emergency department to make sure that you get your urgent tests done. So don't worry too much about that one. I had a really good question that came out here because of the increasing number of COVID cases that asked whether or not the COVID virus, if somebody is wearing a mask, will not be transmitted to their close contacts. And the answer to that is no. If you have been identified as a positive case of COVID-19, you cannot put on a mask and continue to have contact with people around you. You are required by public health law at this time to isolate for the 14 days. Right now, some of you may be getting phone calls that you find kind of scary, where someone tells you that they are your employee, for example, or someone you work with as a coworker, or possibly a friend, maybe even someone in your cohort saying, I have tested positive for COVID-19 and you are now my contact. There are varying definitions about what a contact is. Our latest information tells us that a close contact is going to be someone who you have spent 15 minutes in less than 6 feet of distance with that individual. If you are identified as one of those close contacts, which is typically going to be people within your cohort family unit, you too will be required to isolate for 14 days. If you are a casual contact, let's say it's your coworker who works on the other side of the building and you may have walked within 6 feet of them on your way to the water cooler, you are not required to isolate for 14 days. You would be given the information that you should be what we would call on watch or on guard for the following 14 days, which means you can still go about your normal activities, but if you have any of the symptoms or start to feel unwell, you should have a very low threshold for speaking with your doctor or calling 811 or going online to book a test for yourself. If you have questions or concerns, please don't hesitate to contact your family physician. They can speak with you over the phone and give you some guidance on what type of precautions you need to take. There seems to be some misinformation out there as well about what a test means. Right now, the test that we have available, which is done through either a nose swab or a throat swab, will tell you whether at the time of your test you have active COVID disease. It does not indicate whether you may have had COVID a month ago or whether you may get COVID tomorrow. It only gives a snapshot in time. For people who have symptoms, let's say that yesterday I got a sore throat. If I go for a COVID test today and it comes back negative, that would tell me that that sore throat was not caused by COVID. I would not have to go in prolonged isolation if I received a negative test. If I had another new symptom present itself, let's say I developed a fever 3 days from now, I cannot assume that that is still a negative COVID with that fever. I know it sounds really confusing. If you have questions, please don't hesitate to contact us. We will do our very best to clear it up for you. I've had a number of questions lately about the mammogram screening bus. In previous years, it has come to Hanna in, I think, June, July. And of course, it was canceled at the beginning of spring and everything has been shifted. We do not at this time have a formal date for the bus coming to Hanna, but I'm thinking it may be here in late fall, October, November. If you are someone who needs a regular mammogram and you're concerned, please come and talk with us and we can get you set up for an alternative location such as Red Deer, Airdrie, or Calgary to get a mammogram done soon and with a definite date. We really don't want to lose you if you need to have your mammogram now. For those of you who might be able to wait, you can certainly wait for more information about when the bus may be coming. There are some concerning myths out there too, where people are saying that wearing a mask is going to cause problems with their oxygen saturations or make them feel weak or dizzy. I can assure you that many of us who work in healthcare have had to wear masks for very long periods of time, sometimes upwards of 8 or 10 hours for a surgery, or certainly during our shifts at the hospital. It's been well studied that our masks do not cause problems with oxygen levels. If you are someone who has a respiratory condition such as COPD, maybe asthma, and you feel very uncomfortable or short of breath wearing a mask, that would be an indication that perhaps you should avoid situations where you're going to be less than 6 feet from other individuals. Remember that you can get things like groceries delivered, or you can go at a time when the grocery stores are not particularly busy and maintaining distance is not a hardship. Consider that. Please don't not wear a mask when you're around people if you're going to be less than 6 feet around strangers, even if you have a respiratory condition. We are still requiring all patients who come to the medical clinic to wear a mask. It does not have to be a medical mask. It can be one that you have as a homemade bandana, something to cover your face so that if you were to cough, your droplets would be contained within that mask. At the hospital, if you show up and you're wearing your own mask, we're going to ask you to switch and put on a medical grade mask. We're assuming that if you're coming up to the hospital, you may have a medical condition which would be more in keeping with possible COVID disease than if you're coming to the medical clinic. I think that's probably all that I have for today. I'm just checking my list. Please continue to contact us if you have issues. Please know that all 4 physicians in Hanna are healthy and seeing patients at the hospital and in the medical clinic. We are open for telephone appointments as well. Just let us know what you need. I'll be back again next week.